Welcome to this explainer. Look, we hear a lot, probably too much, about how artificial intelligence is going to completely revolutionize healthcare. But let's be real, there is a massive, glaring disconnect between those glossy, futuristic promises of AI and the actual daily grind of running most hospitals. Today, we're going to bridge that gap. We're going to break down exactly why leading a hospital into the AI era doesn't start in the IT department, it starts with you, with visionary leadership and a fundamental rethinking of structured data.
So, let's kick things off with a quick reality check. A little thought experiment for you. If your board, or say your quality manager, walked in and asked you this highly specific question right now: how many children under 5 did we see for diarrhea last quarter, and what percentage received antibiotics? Could you give them a firm answer in under 5 minutes? Be totally honest with yourself here.
If your internal answer was, absolutely no way, then take a breath, don't worry. This explainer is precisely for you. And honestly, this isn't a sign of a badly run hospital. It's actually just the default state of practice in so many great hospitals worldwide that simply haven't made a deliberate, strategic decision to change. It's not about working harder. It's about fundamentally rethinking how we capture clinical knowledge right at the point of care.
Think about a wildly busy Monday morning outpatient department. You know the drill. Your doctors might see 65 patients in a shift. They're generating handwritten prescriptions, scribbling down growth charts, noting vaccination updates, writing admission notes. But by evening, what happens? Every single one of those documents is filed away, folded up, or just handed to a parent to take home. Genuinely valuable, life-saving clinical knowledge is dutifully collected, but it's essentially sent to a dark cupboard, destined to gather dust and be forgotten entirely.
The thing is, every hospital already has a data pipeline. But right now, for most of us, that pipeline usually ends with those valuable insights quite literally turning into dust. Your data essentially dies the exact moment a doctor writes it down on a piece of paper. Sure, it's readable by a human if they pull that one specific file, but it becomes completely invisible to any system trying to count, compare, or predict trends across hundreds of patients.
Okay, so to fix this, we need to bust a massive myth right out of the gate. If you ask 10 doctors what an electronic medical record is actually for, most of them will probably say, oh, it's just a place to type my prescription so the pharmacist can actually read it, right? But simply digitizing your handwriting into a computer screen is not creating data. A true EMR is a structured data collection platform.
There is a world of difference between free text and structured data. If a doctor types out a beautiful, grammatically perfect paragraph about a 3-year-old with a fever, a computer just sees a wall of noise. It cannot count those words. But structured data? When you use drop-downs and coded fields for age, sex, and diagnosis, a computer can instantly analyze that at scale. It can literally tell you your exact antibiotic prescription rate for viral illnesses in mere seconds. That is the game changer.
And this brings us to a crucial point: garbage in, garbage out. Look, if a busy nurse accidentally types a baby's weight as 3.2 kilos instead of 2.3 kilos, an AI-powered alert is not going to catch a genuinely faltering baby. It's actually going to be falsely reassured by a typo. AI won't magically fix bad data. It amplifies whatever you feed into it. And that makes data structuring a critical patient safety issue, not just some back-office IT problem.
So, to avoid getting bogged down in engineering jargon, forget about SQL and APIs for a second, let's just think of a data pipeline as a water purification system. A single patient visit is like raw rainfall. The data pipeline is the automated journey that cleans up that messy, raw information. It standardizes it so that wheeze, wheezy chest, and wheezing are all understood as the exact same thing, and then it delivers it directly to your executive dashboards, like clean, usable tap water.
When we string all of this together, you can really see the true patient-to-data journey. A patient walks in, the EMR captures that structured data, and the pipeline routes the information instantly. It transforms a single, isolated clinical encounter into systemic hospital intelligence. And that intelligence is what drives better, faster decisions for the entire facility.
Think of a highly structured EMR as the central nervous system of your hospital. It completely shatters those isolated departmental silos. Reception, the OPD, and the pharmacy, they aren't keeping their own private handwritten logbooks anymore. They feed their specific information into the central system, and in return, they instantly draw vital insights back out, like getting a real-time allergy alert popping up on a screen before a dangerous medication is ever dispensed.
And the so what here is immediate and incredibly practical. Take pediatric vaccinations, for example. With structured data in place, a scheduled automated background check can find every single child due for a vaccine in 3 days and instantly trigger a WhatsApp reminder directly to the parents' phones. No human receptionist ever has to remember to check a dusty logbook or make a single phone call. You get higher compliance, and you, as a leader, can instantly spot dropout trends by neighborhood right on your dashboard.
Which perfectly sets up our next focus. AI is leadership, not IT. Now that we've nailed down the clinical data foundation required, let's explore why this fundamentally shifts your role as a healthcare executive.
I'm going to say this loud and clear. AI is absolutely not an IT project. Delegating your AI transformation entirely to your IT department is a guaranteed recipe for failure. This is a leadership project. It's a people project. It's a workflow project. Leaders, not software engineers, have to own the digital transformation because it touches literally every single clinical and administrative workflow in your building.
What's truly fascinating here is the entirely new healthcare equation we're looking at. In the past, the math was simple but brutal. If you wanted to see more patients, you had to linearly scale up your staff, your physical square footage, and your costs. But in the AI era, scaling your hospital's impact means leveraging better AI to achieve significantly higher productivity from the amazing workforce you already have.
And naturally, this completely redefines executive roles. Take the medical superintendent. Traditionally, this was all about reactive clinical administration, basically running around putting out daily fires. But in the AI era, the medical superintendent steps up as a proactive clinical operations leader, someone who actively designs and tweaks workflows to prevent those bottlenecks long before they ever happen.
The CEO and medical superintendent dashboards of the very near future will rely entirely on clean, structured data. Just imagine opening your laptop in the morning and seeing real-time OPD waiting times, live bed occupancy, and AI-flagged clinical alerts right there. This completely eliminates the nightmare of manually compiling 30-day-old reports that just tell you what went wrong last month. You manage the hospital right now, in the present moment. For the quality managers listening, the shift is just as dramatic. It means finally ending the era of frantic, periodic paper audits. When your data is structured, you enter an era of continuous, defensible compliance. You can track antibiotic stewardship objectively and monitor readmission rates in real time. It makes things like NABH compliance a seamless byproduct of your daily operations rather than a frantic scramble every year.
But as you drive all this exciting change, it is absolutely vital to reassure your clinical teams. We have to address the elephant in the room. AI is not here to replace doctors or nurses. AI replaces the repetitive, mind-numbing paperwork and the administrative delays. It does absolutely nothing to replace human empathy, nuanced clinical judgment, or leadership. It frees your humans up to do what only humans can do.
To lead this transition effectively, healthcare executives urgently need to develop a new set of competencies. You'll need a solid blend of AI literacy and automation thinking to understand the tech, combined with deep change management skills to actually guide your people through it. You're blending your hard-earned clinical insight with modern digital leadership to guide your hospital through what is arguably its biggest transformation since computers were first introduced. And you must understand that the journey from paper records to advanced AI is an evolutionary ladder. You literally cannot skip rungs. You cannot buy some fancy predictive AI tool if your data is still trapped in handwritten free-text notebooks. You must start with structuring your data today, in year one, to earn the right to use predictive and agentic AI in the years to come.
But you know the best part? You don't need a massive six-figure budget to start. You don't even need to buy expensive new software. You just need the discipline to pick, say, 15 crucial fields, like diagnosis, age, and antibiotics given, and capture them consistently as structured dropdowns. Build one single pipeline, like vaccinations, get it working end-to-end, and spend your energy training your staff on why this matters for patient care.
And this leads us to our final section, the future hospital command. Because when you lay this groundwork, you pave the way for the true hospital command center of tomorrow. So to sum this all up for you, AI is fundamentally a leadership competency now. Clear those paper piles out of your cupboards, structure your core data from the very first patient encounter, and personally take the reins of your hospital's digital transformation. Start small, with those high-volume, repetitive workflows where automation provides instant visible relief to your overworked staff. I'll leave you with this final, provocative thought to take back to your boardrooms and chew on today. If AI could eliminate just one repetitive task in your hospital tomorrow, what would you choose? Figure out exactly what that task is, structure your data around it, and boom,
You've just taken your first real step into the AI era.